Hello, I'm Lucia Gambuza with Ophthalmology Times Europe, joined by Professor Gündüz from Ankara University, who presented at the 2026 European Dry Eye Congress in Milan with a study on ectoine, a molecule first discovered in bacteria that survive extreme environments, as a potential treatment for dry eye disease. Professor Gündüz, thank you for joining me today.
Thank you.
My first question, ectoine comes from an unusual place, bacteria that survived extreme heat, salt, dryness. Can you walk us through your study and how that molecular shield mechanism protects the ocular surface?
Surely. Well, thank you for having me. Um, Ectoine is quite different in regards to few of its potential properties. First of all, ectoine is totally natural. It is a natural osmoprotectant. It is, as you have already mentioned, it is only secreted by extremophiles, meaning extremophilic organisms living in extremely harsh conditions like very high salinity, high pH, high osmolarity, or very high temperatures. These organisms actually can survive and thrive with the help of ectoine under these conditions. What ectoine does is it is very extremely hydrophilic and it binds very strongly to water molecules. And this ectoine water complexes form a net-like structure that covers the surfaces of cell membranes, macromolecules, and protect the cell membranes and protect the proteins. And ectoine actually, in this way, works as an osmoprotectant, and it also has a downstream anti-inflammatory activity, as evidence shows from both animal studies, preclinical studies, and also clinical studies. Well, first of all, ectoine was tried in human corneal epithelial cell cultures. In these cell culture studies with desiccating stress, and also in afterwards in murine and mice animal models, again exposed to desiccating stress, ectoine could actually suppress the expression of anti-inflammatory cytokines like the ones we know for their potential devastating effects in dry eye, like interleukin 1, 6, TNF alpha. And also, it could help recovery of goblet cells. It could increase the secretion of goblet cells, increase the mucinous secretions, and also it could decrease the ocular surface staining in these animal models. So, as such, the ectoine's potential in dry eye disease was actually shown in preclinical and animal studies firsthand. And then came the clinical studies. Ectoine was uh, actually first tried in a double mask randomized study, and compared to its comparator, ectoine containing artificial teardrops ectoine containing sprays, actually, eye sprays, could increase tear film breakup time and also help these patients with their symptoms. So, as such, the ectoine's potential in dry eye disease was actually first shown.
Can you walk me through the current clinical study that you're working on?
We actually prescribe Artelac ectoine eye drops to uh, patients with moderate to severe dry eye disease. And at the end of the 1 month follow-up period, we look at their tear film breakup time and also Schirmer's tear test and their symptoms and everything. And until now, in these patients, what we saw is at the end of 1 month treatment, patients who were prescribed Artelac ectoine eye drops 6 times daily, these were patients were only given Artelac ectoine eye drops and nothing else. At the end of 1 month period, these patients had a significant increase in their tear film breakup time. The Schirmer tear test also increased, although not quite significantly. But we also saw improvement in all their symptoms related to dry eye disease. Like we have said, burning, foreign body sensation, dryness, redness, etc. And again, the drug was very well tolerated, and patients had immediate relief of all their symptoms, no irritation right after installation. So it was very well tolerated, and it was also this was also important for us. So at hand, we have this study, and we are working on it, and we are very happy about the results.
I'd like to talk about that tear breakup time and those specific endpoints. Which shift or difference do you think will matter most to a patient sitting in an exam chair?
Well, first of all, these patients always have symptoms. Dry eye disease comes with dryness, redness, foreign body sensation, grittiness feeling, burning. So Ectoine, with its huge water retention capacity, first of all, suits these patients. In studies, it was shown that it is very well tolerated, and right after installation, the patients have a decrease in their symptoms, feels relief. So that is important to the patient. But this anti-inflammatory activity is very important for us in regards to the progression of dry eye disease and the vicious circle starting with inflammation in these cases. So, with its anti-inflammatory activity, we know that it's very important in dry eye disease. With this anti-inflammatory activity, it also helps the tear film and ocular surface homeostasis to be rebuilt. And also, its activity on goblet cells is also very important. So, it's like both the osmoprotectant lubricating effect together with actually the artificial tear formulation. It is very important to the patient, but also this anti-inflammatory activity is also quite important.
Yeah, I'd like to stay on the topic of the symptoms that you mentioned. Patients in your study reported improvement in redness, tired eyes, burning, and foreign body sensation. That's a pretty wide range of complaints. Was there anything that was surprising to you?
These dry eye patients may have, significant dryness when you examine the patient at slit lamp with staining and all of that stuff, but may not have that many symptoms. But on the other hand, most patients come with significant symptoms because they are really they cannot go on with their daily life because of these feelings, because they use, uh, also screens. They the environmental factors, they usually have symptoms. And with some formulations, even if you have better ocular surface effect, less staining, better tear film breakup time, retention of the tears on the eye, the patient may not have relief and may not have better symptomatic properties, and then they may just leave the drop. They may just not stop using the drop, and therefore you don't get in the end any effect from the formulation. Although it's a good formulation, it has anti-inflammatory activity, osmoprotectant activity. Once the patient feels this doesn't make any difference in her or his symptoms, then they may just discontinue and you are left with nothing. So it is important for us that all of these symptoms can be better with the use of this drop so that the patient continues, and then you can also end up with better ocular surface effects.
What would you want to see next before recommending Ectoine more broadly in practice?
Well, first of all, it is important that we show the effect of this drug in this drug formulation in clinical studies. Okay. And once the clinical studies also support, and in fact, we have a clinical study right at hand right now. Once they support the use of this drug formulation, then we can also better communicate with the patients and help them understand how the patient's uh, relieved, got relief in regards to their symptoms, but also we had an effect on the ocular surface homeostasis.
And my last question, where do you see an osmoprotecting protectant like Ectoine fitting alongside newer FDA-approved drug classes like TRPM8, neuromodulator, or a tear film stabilizer?
Well, Ectoine, these artificial teardrops generally uh, used to be just lubricating the eye in former years previously. But now artificial teardrops have expanded in their mode of action. They can modulate osmoprotection. They can help protect the ocular surface. They can down regulate inflammation. They can have antioxidant activity and others. Like they have a combination of effects on the eye. So, Ectoine has both a good lubricating effect, particularly the Artelac Ectoine formulation having also the hyaluronic acid in it. It has a perfect viscous and enhancing activity, viscosity enhancing activity. It has perfect lubricating activity. In addition, it can protect the cells and also can downregulate the inflammation on the eye. In this regard, ectoine formulation, Artelac ectoine formulation particularly, can be used in dry eye disease of any severity, mild, moderate, severe, right? And also it can be used because of its anti-allergic activities. It can also be used in allergic patients with or without dry eye disease and also in dry eye disease patients with or without allergies. So it has a combination effect. It can be used in all kinds of dry eyes, in all severities of dry eyes, and also particularly in eyes with allergy and dry eye, maybe it can be helpful with any kind of allergies at the clinical, mild, moderate, severe. Again, even if the patient does not have any dryness, we always prescribe preservative-free artificial teardrops. In that regard, with its anti-allergic activities as well, Artelac Ectoine can be used as a go-to drop as well, in addition to topical antihistamines and other drops that we use.
Thank you so much for breaking that down for us. It's a fascinating direction for dry eye care.
Yeah, it looks so. Thank you so much.
For more information on the European Dry Eye Society Congress and the latest news in ophthalmology, visit europe.ophthalmologytimes.com.